Welcome to the Windsor-Essex County Health Unit's media briefing for Thursday, January the 20th. We are joined by our CEO, Nicole Dupuis, and Dr. Shankar Nasathuri. We will get started with some opening statements from Nicole, and then we'll move into our media questions. Go ahead, Nicole.
Okay, good morning, everyone. Thanks for joining us. I just wanted to let everyone know we've been talking about for a few weeks our data. So normally on Thursday, you're used to us doing an epi summary or epi overview. We won't be walking through the numbers today, as we have noted with the change in testing. The information that we have has changed. We are working on a dashboard of indicators, and we plan to have that up and running next week, as well as our local data page will change next week. And so just wanted to inform everyone that, when we get together again next week, we'll be able to go over the indicators that we'll be using, the information that we'll be sharing, and hope to have that next week. But just wanted to start off letting everyone know that we will have some numbers to share, and they'll be shared with you later today. But we won't be doing our normal presentation, and we'll shift to something new starting next week. Thanks.
All right, thank you. We will move to media questions, starting with AM 800.
Nicole, just to that point, I know we talked about before about the different indicators, but what can the public expect next week when they go on the health unit's website?
So we're just reviewing it. As we said, our EPI team's putting it together. We're looking at adding, just revamping the entire page. Certainly we'll need to provide different descriptions, and we also always want to inform people, what the information means. We're looking at items. We'll still report some of the testing information that we have, albeit with some considerations for how best to interpret it. As well, we'll be looking at hospitalizations. We'll likely be removing some of the breakdowns by, age and gender, because, just with the limitations. We'll be adding elements, and I think we've spoken to this before, around wastewater data, which we still have access to. So, it'll be some significant changes. Like Rob, our team's just reviewing it now, and we hope to have it finalized for next week.
Thank you. Doctor, later this morning, the Premier is set to make an announcement. Sounds like some restrictions are going to be lifted. I know prior to the provincial restrictions, there was a letter instruction for Windsor-Essex that you put in place, and then obviously the province put the restrictions in place. Who knows what the Premier and his team are going to say today, but just wondering, do you think Windsor-Essex is ready if some restrictions do get lifted?
I think that, we're in a very challenging situation now because we don't really have a clear metric of the burden of disease. And the cornerstone of making public health policy and public health practices to identify a goal, to measure it, to implement a public health policy, and to monitor to see the effect. So at this point in time, I think that that's the challenge that we face locally, and we face at a provincial level. We always try to work with our colleagues at the province to formulate effective public health policy, and I look forward to hearing what the announcement, what the details of the announcement will be later today.
Is the local health unit's letter of instruction still in place, or did that get removed once the province put the restrictions in place?
The letter of instruction hasn't been officially removed, but it's covered by the provincial legislation. So with any rules locally that we have, or provincial rules, you'd always go to the to that which is more restrictive.
I guess I'm asking, if the province decides to reopen some establishments that were part of the local letter of instruction, would the local letter of instruction still remain for Windsor-Essex, or would I guess, what the province announces take over?
Yeah, we obviously want to have clear direction and clear guidance to the people who live in the community. Once we know what will be announced, and I don't have any knowledge of what will be announced. Once it is announced, then we'll try to make local policy consistent, or the guidance consistent with the provincial guidance. It's difficult, as a generic construct, it's difficult to comment on the future or predict the future. So I think at this point, before we can say what the health unit's approach would be, we need to hear what the announcement, the contents of the announcement later today, and then we can formulate the most appropriate approach.
Thank you.
Any questions from CTV?
Yes, good morning. I know that you don't know the specifics of the announcement yet today, but what do you hope is in there, and do you think that restaurants and gyms should be allowed to reopen?
I think that, again, I'm hopeful that any future public health policy will have a measurement of the burden of disease, clearly articulate what the policy is, and then have some monitoring plan based on the indices that we use. If the plan is to move forward with relaxations of public health direction or public health practices, then I would hope that we would monitor the situation. I'm sure the province will monitor the situation, and then decide if that approach has not led to a substantial increase in the burden of disease. We have to wait. I think that at the end of the day, we have to wait to hear what the province has to say. And once they've made their determination and announcements, we can then formulate an approach at the local level.
Okay, thank you. And from a public health perspective, how has the return to in-person learning at schools been going so far?
So maybe I'll start. I'm not sure what the measurement would be of how it's going. It's been a couple of days. We are in constant communication with our school board colleagues, certainly to support them, both with communication and, as students return and continue. It's obviously much different than how we work together and manage prior to the holidays. So I'm not sure that we can give a accurate answer of how things are going. Probably best answered by our colleagues at the school board, but we are working closely together to make sure that any tools or resources or communication are clear, and we're in constant conversation to monitor how things are going. And I don't know if Dr. Nestori would like to add.
So at the onset, COVID-19 is a communicable disease transmitted substantively by respiratory particles. Anytime there's more human-to-human interaction, there's a greater risk for disease transmission. That being said, nothing is completely risk-free, and in the spectrum of public health interventions, I think that young people should be the least disadvantaged by that. So to the extent the schools are open, and to the extent that schools are open, particularly for elementary school children, I think that's a positive step for the community. The issue is not about is any one activity safe, but is it safe? Is it sufficiently safe? Every time we get in our car, we take the risk of being involved in a motor vehicle crash. In this particular case, I think schools can be open safely. And we'll monitor to see if there's evidence of increased disease transmission. I think that that as we move forward with public health policy, I think that we should really endeavor to keep schools open and only curtail educational activities when absolutely necessary.
Okay, thank you.
Any questions from CBC?
Yes, good morning. Could you provide numbers on how many temporary foreign workers are currently in isolation or have tested positive for COVID-19?
I don't have those numbers to provide you off the top of my head, but we can, we can provide that later. We'd have to provide it in an email later.
Okay, I'll follow up. There are reports that a temporary foreign worker has died in isolation locally. Can you confirm that?
Yes, typically we do our very best to protect the privacy of all the people we serve. So we can't comment on any specific case or death. I could share with you, in general, the public health services perspective on this. It's true in medicine overall. Anytime there's an unforeseen or event, and that includes a death, we try to understand what the facts and circumstances of that death are. And the most important thing is to learn from that event to see if you can prevent events from happening similarly. So in the case of a death, we would like to understand more about the causes of the death and the circumstances surrounding the death. And many times, but not always, the office of the coroner is involved. One thing we've learned through the pandemic is that, and let me preface this by saying, there are two forms of self-isolation. One is the initial period that someone might have to serve, and this is more typically called quarantine when they arrive into the country. And then there's a period of time which is called self-isolation, as if one is exposed to COVID or one is infected with COVID. Typically, when people are in self-isolation or in quarantine, they should have their own bathroom, and they should be away from other people, separated from others. What we've learned from the pandemic is that people in self-isolation and quarantine need support. And they need supports for their medical care. If people are sick, they need someone to check in on them. If they're clinically deteriorating, to be able to access hospital healthcare services. If they're substantively deteriorating clinically, to be able to go to the hospital. People in isolation also need psychosocial supports, and they need operational supports, meaning someone to provide food and sundry items. And I think that as we move forward in the pandemic, those are three things that we should be cognizant about, and endeavor to try to provide the very best self-isolation supports that we can for people, either in the quarantine period or in the subsequent self-isolation period. The other comment I'd share is the quarantine, the initial arrival into the country, is managed by the federal authorities, and it may be helpful to have the federal authorities comment on how that's managed as well. The Public Health Service is involved when people test positive for COVID, or there's an exposure to COVID, meaning that someone who has COVID is exposed to other people. And those are sort of the two substantive reasons why Public Health Service.
It's been nearly a week now, Dr. Nesatheri, since you rescinded a letter of instruction about halting the arrival of temporary foreign workers. Do you feel that the region has enough support currently to care for the arrival of those individuals into our area, and once they get here, if they get sick?
Well, I think that the first thing I'd say is that the letter of instruction was put in place in part to make sure that the current community of migrant farm workers or temporary foreign workers had support. We had estimated approximately 10% or more of that community who was already here was required self-isolation, and we had saturated all of the resources available at that time. I think since the letter of instruction was implemented, additional self-isolation resources have been identified, and I think at the current time there are sufficient self-isolation resources for members of the migrant farm worker community who may require that. And given that, we felt comfortable, and I felt comfortable withdrawing the letter of instruction because I think it is safer now that there's more self-isolation resources identified. But one thing I would share is that it's likely that the number of people requiring self-isolation will vary from day to day, week to week. And it is likely that the number of people requiring self-isolation on any given day will increase with the number of workers arriving. We estimate, I think the estimated number is there's approximately 2,000 temporary foreign workers working in farms at the current time, and we expect a community of perhaps 8,000 to 10,000 people. I think this is really important, and if I could just emphasize this, and maybe this message has not been well articulated. We're concerned because of the living circumstances of the people, and not because of where they come from or who they are. We treat, the Public Health Service, people who are part of the migrant farm worker community are residents like anybody else. And we focus our resources on people who need more services, who are at higher risk of getting sick. But in this particular case, we're dealing with a disease, COVID, which is primarily transmitted by respiratory particles. And we know when people share bedrooms and kitchens, it's more likely to go from person to person to person. We know that in a 4-person household, perhaps 2 parents and 2 children. We know that at other congregate settings where people share bathrooms and kitchens, be they retirement homes or long-term care facilities or homes for people with intellectual impairment. In the case of migrant farm workers, there are instances where 20 people share the same bathroom and same kitchen. So if one person becomes infected with COVID-19, all the other 19 people are presumptively or are likely to be close contacts and likely to have been exposed and have a reasonable chance of getting infected. So that is our struggle. Now, on a population community level, Windsor-Essex has more migrant farm workers than any other health district in the province. It has between 8,000 and 10,000. The district that's number 2, which is Haldimand Norfolk, has about 4,000. And Windsor-Essex has about 1,000 residences for migrant farm workers, or 1,000 bunkhouses. And that is a community of people that we're very concerned about because of the transmission of COVID-19 among that community. The second issue is that at the current time, public health policy is to try to diminish the number of cases overall in a hope not to saturate hospital resources. And we currently, and I think we can get the exact number, but I think we currently have hospital occupancy above 95%. So there's little extra capacity in the health system if we have a large surge in people presenting for hospital services. Again, I apologize for that long-winded response, but I hope that provides some context.
Thank you.
Any questions from Blackburn?
Yes, just coming off your last question, the current hospital occupancy of 95%, little capacity if there's a surge. Today, we expect the Premier to announce that he's ready to lift restrictions, possibly as of January 31st. Are you concerned about our hospital capacity if we are now going to be opening up to half capacity at restaurants, bars, gyms, etc.?
Well, we constantly monitor the hospital and just not the public health service, community overall monitors hospital usage. It is likely that as you remove restrictions, that you're going to have a greater number of people who are infected and transmit COVID to others. And so I think that whatever policy related to relaxations is put forth, we should monitor carefully metrics such as hospitalization, ICU utilization. So it is something that clearly we have to monitor moving forward. And I think it's a perfectly reasonable for to ask the province about the monitoring plan, as we would for any pandemic type relaxation. What are the components of monitoring to see if the effect can be sufficiently managed?
The other question I have for you is a little bit off topic. It's still about COVID, but today we published a story about a very, well, I think it's disturbing poll. And it was done by Maru Public Opinion. In it, 54% of those they surveyed said they don't have sympathy for the unvaccinated who get seriously ill or die from the virus. I know you don't like to give your opinion, and I know you like to stick to facts. I was disturbed by this, but I'm interested to hear what you think of perhaps our hardening attitudes towards the unvaccinated.
Sure, that's the toughest question I've had in a long time. It's been 2 years, right? We've all lived through this for 2 years, and we've all been affected by it. There's not a single person whose life has not been disrupted by COVID. And anytime you have such a significant disruption in the lives of people, it's only I can understand why there's some level of adverse opinion to the people, to others. I think at the onset, and I would plead with people who are not vaccinated to get vaccinated. And the first reason, as a doctor, we obviously care for all people. I was just on the phone with a colleague of mine in the ICU, and many of the people dying of COVID, they're senseless deaths. They're people in the prime of their life who have been taken from their families, taken from their children, taken from their parents for no good reason. For the most part, the people dying of COVID are unvaccinated people, and people who are vaccinated have significant medical comorbidity, like a transplant, an organ transplant. So my first message is, if you're not vaccinated, please get vaccinated. And if you can't do it for yourself, do it for your family, do it for your children. The second issue is that as doctors, we have to have compassion for all people, even people who don't agree with our public health advice. I would say that that if someone is sick, the healthcare system has an obligation to treat them as best as we can within the resources we have at that time. And if someone goes to the hospital, every resource of the hospital should be available to every patient. We can't practice medicine in any other way. So I would say that although I understand why this poll might suggest people are angry, I think that really the focus has to be on trying collectively to do better so we can bring COVID-19 under control. The other thing I would share is that we have to shift to some point into normalization, which is also something that we, as all of us, have to think about. It's likely that COVID-19, like other respiratory diseases, is going to be with us in the near and intermediate term. And I think vaccine will play an important role. Antiviral drugs, I think, ultimately will play an important role. But we also have to learn to manage COVID-19, because we're not going to be able to eradicate it. And that management approach could also include different variations or different levels of public health measures, depending on the burden of disease to the community overall. I think that's a hard shift in our culture to recognize that it's not going away, but I think that that's something that we have to consider moving forward as well.
Do you think? Oh, sorry. Go ahead, please.
No, I apologize. I meandered in that response, but it's I think a worthwhile dialogue we all need to have about how we're going to move forward with COVID-19. The one thing I would say is, no matter what the public health management is, schools should be the last thing to close. If there's one lesson we've learned, is that schools should not be the we should only affect the lives of school children when all other options have been exhausted.
Does it disturb you that this seems to indicate a growing lack of compassion?
Yeah, I don't know if there's a growing lack of compassion. I think it's a poll, and the way questions are framed in a poll can also effectuate the type of responses people might give. I would reframe it as we owe it to each other to, in all matters of our life, to show compassion to other people. The health system's cornerstone is compassion, is to understand how we can comfort the people who are afflicted by illness, and if at all possible, to try to mitigate illness, and on the few instances, try to cure illness. So I think that I would temper that. I think I would temper that and say that I'm hopeful that people will express and continue to express compassion towards other people.
Thank you.
Any questions from the Windsor Star?
Yes, good morning. We're seeing a resurgence in cases in long-term care and retirement homes over the last few weeks after many months with either no cases or very few. So I'm wondering if health unit outbreak investigation has come to any conclusions about how we're seeing such significant spread, especially after waves where so much was done to prevent it from getting into these vulnerable sectors again.
Nicole, do you want to start a comment and then maybe I can supplement that?
Yeah, I don't think it was unexpected. We are seeing significant with Omicron, and we know, additional vaccination is very important, in particular in that vulnerable population. And I think despite some of the conversation around Omicron being quote unquote milder disease, we know certainly since the beginning of the pandemic, individuals, there are certain groups and populations that are more vulnerable to severe outcomes, and that includes individuals that are elderly or older. And so we do have a significant number of outbreaks, and as a health unit, we continue to work with every facility closely so that they can put in those both proactive and then further preventative measures to manage the outbreak and contain the outbreak. But again, with the number of cases that we expected as it related to Omicron, it wasn't unexpected that we would see a surge, within some of these settings, and which is why, our attention, at least from a case and contact management perspective, was prioritized and focused on these settings rather than, the larger community.
The number of institutions affected by COVID is a function in part on the overall burden of cases in the community. So one way that COVID gets introduced into a community of people living in a long-term care facility is that visitors, workers, staff are infected, and there may be breaches from that group of people into the long-term care community. I think overall we've had, Nicole can correct me, I think overall we've had in all institutional settings, workplaces, I think approximately 100 outbreaks since the beginning of the year. It's sort of a staggering number, 100 outbreaks since January 1st. So we're 3 weeks into the year. I think the goal of management, public health management, is to try to minimize the breaches or minimize the number of cases that make their way into a long-term care facility. And if it does make its way into a long-term care facility, to ensure that the people are as protected as best as possible, which is to be vaccinated. And for the most part, vaccinated people are far less likely to get COVID than unvaccinated people. And so the goal is a multi-leveled or a multi-layered approach. One is reduce the number of cases in the community. Secondly is to screen individuals before they get into the long-term care facility. So if they're sick, that they remain, they don't get admission to the facility. And then to wear personal protective equipment when providing care to people living in the long-term care facility, minimize the number of people who use the common bathroom, and minimize the number of people in any particular room. And then if someone is infected, to identify them early and provide them and to isolate them from other people at the facility, and then provide appropriate medical treatment in a timely manner. I think if we do that, that'll be the way to mitigate or to manage COVID-19 exposures, because I don't think that we'll be ever able to eradicate COVID-19. And I think that would be the approach moving forward.
And is it the case that testing is available for long-term care retirement home residents and staff?
Yes, so they continue to be prioritized for testing for PCR, and also facilities are using rapid antigen tests as well. So both are in place, and as Dr. Necessary said, there are visitors and individuals that come in, and they're subject to screening and testing as well. Yeah.
Thank you for that. And then finally, just to be clear, did the health unit complete a third dose booster rollout at those facilities when third doses first became available?
Yeah, so third doses or booster doses for the long-term care retirement home, as you probably recall, that rollout actually occurred in the fall. And so we were, very quick in rolling that out. We are now actually in the process of fourth doses as well at the same time for any staff who are still eligible, haven't received their third dose yet. That can occur at the same time. So right now we're rolling out fourth doses across our long-term care and retirement homes, as well, reinforcing and initiating third doses for any staff.
Thank you.
Any questions from Radio Canada?
Yes, good morning. Dr. Nasitouray, coming back to the death of the migrant worker, you said earlier that people in isolation need bathroom and help and support. I'm not sure I understood why you were actually saying that. Were you trying to say that it was actually something that person needed? I'm trying to understand what you were trying to say.
Yeah, I guess the first thing I'd share is we can't comment on any individual case or person, but as a general construct, if someone's in self-isolation, they should have their own bathroom and their own dining facility. That would be the preferred option. And so what I guess my message was that despite the fact that we can't comment on any individual case, as a public health service, we do learn from events, and there have been other deaths of people in self-isolation. So the optimal self-isolation residence is one where one has their own bathroom and their own kitchen. Optimal self-isolation residence is one where people have access to medical care. The optimal self-isolation residence has some mechanism to monitor people. The optimal self-isolation residence has sufficient food and sundry items so people are comfortable, and it has sufficient psychosocial supports. In the case of people who are far from home, it's true for all people who are far from home. If you're far from home, you're already deprived of your family, and so when people are far from home and have to self-isolate, our very best to provide a fulsome level of supports for those individuals. The other thing to think about is when people die in self-isolation, they could die of COVID-related items and not COVID-related items. That doesn't diminish the burden of death or the tragedy of the death, but people do die of COVID-related diseases, and they die of diseases that are unrelated to COVID. So that's what we've learned over these past 2 years in the pandemic, and that's what I was trying to share.
Okay, thank you. And sorry if I'm asking you a question that you have already answered. So did you you said you're not commenting on individual cases, and I understand, but did you at least confirm the fact that a migrant worker has died?
Yeah, I know why. I understand the basis for the question. We don't comment on the occupational status of the people. So I can't really share more than what's already shared. And I think in the Windsor-Essex Health District, they typically share the age of the person and about the time when we think the person died. And I can't really make any additional comment on any specific case.
Thank you.
We will do one more follow-up question from our outlets, starting with AM 800.
Just a quick one in regards to just later today. So, Nicole, will the health unit be issuing a release sometime after the Premier's announcement?
I don't know that we'll be issuing a release. I think, we're just as interested to hear what the announcements are as everybody else. And, our team will review and then go from there. I can't promise that release, depending on, I suppose, on what the announcement is, that there will be a release today. But we usually do try to follow up with information, at least, locally, to say what has changed and, how that may impact or not impact any local decisions or orders or strategies. So sort of a non-answer for you, Rob. Sorry.
No, I appreciate it. Thank you.
Follow-up question from CTV.
Yes, I know you don't have the epi summary this week, but from the data that you've seen, does it appear that the region is reaching the peak in this latest wave? And are we in comparison to, or how are we in comparison to the province, who provincial officials said yesterday it looked like the province would be reaching the peak by the end of the month?
You want to start, Doc?
Yeah, we can't conclude that we're at the peak. The doctors are always cautious, and so you can, and the public health service, we're very cautious at the Windsor-Essex Health District. What we do know is the number of people hospitalized, I believe, is I think 130. Around 130 in the health district. So approximately one in every six patients in the hospital has COVID. We can, if you send us an email, we'll try to give you a more fulsome number. The only way one will know if you're at the peak is after the peak is done, and it's not a data element that you can predict moving forward. It's something you have to look backwards. The decision on what suite of public health measures and what level of restrictions is in part a judgment call that provincial officials have to make based on the data that's available to them. The only thing that the one substantive item I would say is that as a general public health approach, whatever set of relaxations or restrictions one places, one needs a monitoring plan to see what is the effect. And if the effect is acceptable, then one can continue to move forward. And if the effect is unacceptable, then one has to reconsider that approach. And that, I think, is the key item that I would want to know more about. And like all of you, we're waiting to hear what that announcement, what will be contained within that announcement.
Okay, thank you.
Follow-up question from CBC. We can come back to CBC. A follow-up question from Blackburn.
No, I think I'm good for today.
Thank you. Follow-up question from Windsor Star.
No, thank you.
Follow-up question from Radio Canada.
No, thank you.
Follow-up question from CBC. All right. Thank you all very much for joining us today. We will meet again for our next scheduled media briefing on Thursday, January the 27th. Have a wonderful day.
All the best.
Bye.
Bye, everyone.